Hello, I'm Dr. Amrita Razdan Kaul, a senior consultant in Obstetric Gynae from Faridabad AIMS Hospital, and today I shall update you about the importance of preterm and prematurity in pregnancy. Pregnancy is an event of 40 weeks duration whilst calculation from your last menstrual period, and fetal maturity in terms of fetal survival is by 37 completed weeks of gestation. So, any delivery or impending delivery which occurs before 37 completed weeks is called a preterm delivery, and a newborn which is born thus becomes a premature one. Now, why should we be concerning about this preterm and prematurity? As we all know that baby is not fully mature when it is born before 37 weeks of gestation, fully mature in terms of sustaining its respiration, its feeding process and neurological responses, hence endangering its survival. And these responses are poor, so this adds a burden to the neonatal intensive care unit to take care of such babies, and it becomes a leading cause of the neonatal death. Now, what exactly predisposes to this condition? Although demography of the patient like extreme of ages, obesity, then malnutrition and low socioeconomic status with excessive strenuous physical activity are the independent risk factors, but a previous history of preterm delivery or prematurity increases the recurrence risk of this preterm event in next pregnancy by 30%. In addition to this, the risk of infections of any sort of body organs, rather starting from oral, periodontal to gastrointestinal, upper respiratory tract, urinary tract infections are impending cause of this prematurity, but the infections of vagina and the lower genital tract are especially notorious, leading to this event of prematurity. To add on to this burden, the medical comorbidities of patient itself like diabetes, hypertension, autoimmune disorders, chronic kidney disorders further increase the risk of this before term deliveries. Uterine malformations like septate uterus, bicornate uterus, cervical weakness, whether inherent in form of cervical incompetence or which is acquired following any cervical surgeries like conization, further increases the risk of this prematurity with the increasing gestation of the pregnancy. Now, certain pregnancy events which increase the uterine size or over distend the uterus size in twins, triplets, or in polyhydramnios where the fluid around the baby is too much to sustain, it predisposes again to uterine pain before gestation. Then preeclampsia where the BP escalation happens in pregnancy event itself, or the bleeding during the pregnancy which is known as antepartum hemorrhage. Further increase the risk of resulting in the preterm delivery. The assisted reproductive technique procedures with anxiety, patient's own anxiety, depression, further predispose a patient to preterm events. Smoking especially, it can increase the risk of prematurity. Now, having said all these predisposing factors and everything, how the patient should report back? The clinical diagnosis mainly by the presence of regular painful uterine contractions which present with the cervical changes like dilatation and softening. So as soon as a patient comes to us, even with the suspicious or very early findings of this preterm labor, we are able to start with the treatment to either control these changes of the uterine contraction or to delay the progress of the contractions so as to investigate the underlying cause and then possibly treat the underlying cause, and more so ever, last but not least, to give the steroids to the mother in order to ensure the fetal maturity of systems of respiration, the safety of the intestinal system of the baby, and the neurological protection of the neonate, so that even though the delivery does happen, at least we are able to give the sustainability quotient to the newborn so that till the baby is in the nursery or NICU, he can sustain its survival instincts. Thank you.